Hi, Yale.
Hi.
Can you tell me a little bit about yourself?
Sure. My name is Ilya, and I'm 24 years old, and I'm here at the YSN Nurse Practitioner Program. And specifically, I'm working to gain my licensure as an adult mental health psychiatric practitioner. And the reason I really was interested in doing that was I really wanted to work in mental health. I kind of grew up all over the world and always had an interest in psychology, and did my undergraduate degree in psychology at the University of Virginia. And I took a year off while I was doing that and entered the SWAP program, the Students Working Abroad program, working in Vancouver, British Columbia. And I also did some just general work on the West Coast, just nothing really that exciting, just grocery work. But again, it kind of strengthened my desire to go into nursing. And specifically, I wanted to go towards an advanced degree because I wanted to be the most I could in terms of mental health. And I kind of started off with the ambition to work in mental health. And I looked at a lot of the venues or a lot of the avenues which I could take to become a good practitioner and provide good service. And I thought the nurse practitioner would be very effective, and probably the most effective, because for one, you're trained in both prescriptive and kind of conventional talk therapy. And in addition, with nursing, you kind of approach health with a very holistic perspective. And for me, specifically dealing with mental health, I thought, really any health problem you should approach that way, I believe. But especially with mental health, I think not taking in the grander picture really makes you miss out on a lot.
And so in America, to pursue the way to practice in psych, there's the medical doctor degree, but there's also clinical psychology degrees. There's also CNS in psych. There's so many options, but you picked this one.
Yeah, no, I picked this one, again, because I didn't want to kind of limit myself, we can start with what you mentioned first, I believe it was the kind of PsyD, the kind of practicing psychologist, and I didn't pick that because I didn't want to be limited to just performing kind of talk therapy.
So they're counseling only, they don't prescribe.
Right, exactly. They don't prescribe any medications to people. And I also didn't want to limit myself in the psychiatric world just because they realistically don't focus that much on talk therapy there.
You're talking about the medical?
Yes,
oh, okay.
Excuse me, to become a medical psychiatrist. They focus more on prescribing. And if you go to many offices here, and many mental health offices, what they have are both psychologists and psychiatrists. And I thought it would make more sense to have one person who can really get the whole perspective other than getting kind of secondhand information from another practitioner. Kind of bringing it together and treating the patient in both modalities.
It's true, a lot of patients here actually have a psychologist to counsel to talk to, and then they have a separate psychiatric medical doctor to receive the medications from. It's kind of a parallel approach. I see. All right. And you've been in this program, you're only in the first year of the NP program so far.
That's correct.
How has it been?
It's been fantastic. I have to say my strongest interests, of course, are in the mental health world, and my clinicals, my kind of practical work in a clinical setting has just been amazing. Just kind of one of those situations where at the end of the day, you're absolutely exhausted. You are spent, but at the same time, you know that you did really good things for people. And you also just did a lot. You've learned a lot. You've experienced a lot. If I can kind of anecdotally talk about one experience I had 2 days ago, we went. I work in an acute services division. So if there are anybody with real serious acute problems, they come in for primarily outpatient treatment. The other day we went on a mobile, which means we go out to someone's house who's having an acute crisis. And this patient, we had to go in with police officers because the patient had just purchased a pellet gun and was extremely delusionally paranoid. Had tape across all the windows, had little booby traps around to prevent people from entering the house. And once we came in, there was into the house, there was tinfoil over the window, or the light fixtures, because she was afraid that people were bugging, planting electronic bugs to survey her. And it was just, it was one of those mixed feelings where you're really excited to see something new and see something so extreme, but at the same time the kind of the compassion that you feel for someone who realistically does fear that is really, really, it makes the work worth it. And again, in psych, I think very much any avenue that you choose to pursue such a degree, you'd want to make sure that you distance yourself from the patient. I know that all mental health practitioners have to do that, but in psych, it's a very tricky game.
Yeah, especially psych.
Yeah,
especially psych.
Exactly, because you're trying to get into people's heads, but not so much that you're personally and emotionally affected by it.
And you're learning that here, huh?
Exactly, I'm learning that with a great clinical experience. My preceptor, the kind of teacher in the clinical setting, is doing a great job at kind of allowing me independence, yet at the same time providing me that support that I need.
Good, good. Well, thank you very much.
My pleasure.
Okay.